Hi, my name is Courtney Talcott, and I'm a nursing student.
Hi, my name is Haajar, and I'm a pharmacy student,
And we both go to MCPHS University.
and we're working on the interprofessional education project where a pharmacy student and a nursing student work together on a patient case. And our patient case today is JS, who is a 76-year-old white male. The three chief complaints he presented with are that I forget to take my meds. Sometimes I have trouble watching my diet and I want to eat everything in sight. And sometimes I feel tired after my hemodialysis and it really gets me down. His history of present illness is end-stage renal disease that resulted from chronic glomerulonephritis due to uncontrolled, untreated hypertension. His past medical history and past surgical history involves many things. In chronological order, in 1992 he had a heart attack and a gout attack, a gouty attack, and then in 1993 he was diagnosed with hypertension and glomerulonephritis. In 1997 he had his first transient ischemic attack. Then in 1999, a bare metal stent was placed in his left circumflex. In 2007, he had his second transient ischemic attack. He also had a chronic subdural hematoma, and he had a left ventricle aneurysm with a chronic left ventricle thrombus. Then in 2009, he had a colostomy. He was also involved in a trial where his doctor had heard about prednisone and placebo being tried out in Italy, and the people that were on prednisone had a really good decrease in creatinine clearance. So he really liked this and gave him the prednisone. This did not work for him, and after being on it for approximately 30 days, he did not have a good reaction, and he actually his immune system was extremely decreased, and he was in the hospital for 2 months after that. Then in 2011, he had his gallbladder removed. There was a lot of pus that had accumulated, and it was really inflamed. So the doctor recommended that it be removed. In 2012, the colostomy that he had added in 2009 was reversed. He and then in January of 2013, they wanted to put a fistula in his left arm, and what happened was they gave him an IV dye that had iodine in it, and he had a really bad allergic reaction to that dye. And then after his whole body was covered in a rash, they stopped the dye, they discontinued it, and then the AV fistula was installed in February of 2013. In 2013, in the beginning of 2013, approximately in March, he started undergoing hemodialysis, and he was also diagnosed with benign prostatic hyperplasia. The allergies to medications that he currently has are acetylcysteine, cefepime, and to the IV dye that contains iodine. And the medications that he is currently on are Sevelamer, which 800 milligrams. He takes 3 tablets by mouth 3 times a day with meals. Tamsulosin, 0.4 milligrams. He takes 1 capsule by mouth every day. And probiotic acidophilus, which is an over-the-counter medication. He takes 1 capsule by mouth every day. He's also on warfarin, 1 milligrams, and he takes 1 tablet 3 times a week and 2 tablets for the other 4 days of the week. And it also depends on his INR. So if his INR is elevated or decreased, then he alters taking the warfarin based on that. And he's also on atorvastatin 20 milligrams, and he takes 1 tablet by mouth every day. He also takes metoprolol tartrate 25 milligrams. He takes that 1 tablet by mouth twice a day. And he's on RenoCap soft gel, which he takes 1 capsule by mouth once a day.
So our patient's family history: his father died of a sudden heart attack when he was only 55 years old, and he told us that his father was very healthy until that day. His mother died when she was 86 of stomach cancer, and presently his older brother has onset of dementia, and his older sister has Alzheimer's disease. His relevant social history: our patient has never smoked cigarettes or used any alcohol in his entire life. He's part owner of a business and still enjoys working behind the counter and waiting on customers. He told us he likes to keep active. He lives with his wife, and he does not need any assistance with any of his ADLs. His review of systems, our patient's weight has been very stable. There has been no significant weight gain or loss. Our patient told us he feels fatigued after dialysis, however. Our patient wears glasses, but he can see very well with them. And our patient has no other problems with his head, ears, eyes, nose, and throat. Patient denies any endocrine complication, and our patient also denies any respiratory complications except for occasional sputum production. Patient states he has high blood pressure, and he's on medication for that. He also mentioned he has swelling in the legs, very seldomly, however, and they always check him at dialysis for this. Our patient denies any gastrointestinal complications or gastrourinary complications, genitourinary complications, I'm sorry, and patient also denies any musculoskeletal complications. Patient said he did have very bad headaches as a child, but has outgrown them. Patient does say he has numbness in his feet and toes, and we both recommended him to speak with his primary care physician or a neurologist, as this could be a side effect of his kidney disease. Also, he denies any hematological or lymphatic complications, and except for when he goes to dialysis, he has to put more than normal pressure on his fistula, and we advise him to let his nurses know that how long and how much pressure he should put on his fistula after dialysis, as it did result one time in him bleeding all the way to his car without him realizing. Patient complained of a rash after an injection of contrast iodine dye for a diagnostic test, and it was discovered later that he was allergic to that dye. So, patient did mention he thinks he could be depressed sometimes. However, he told us that instead of feeling sorry for himself, he tries to stay very active and busy. He keeps himself busy by working. He continues to travel. He likes to spend time with his family and friends and enjoys nature. He told us he went through a bout of depression in 2009 when he was at Mass General for 2 months, and he never wants to be like that again. And he actually told us a funny story. Our patient mentioned he spoke with a psychologist when he was depressed during those times, and that the psychologist suggested maybe shock therapy, and which he quickly made our patient change his attitude overall and realize he had to come up with a plan to avoid his depressive thoughts, which was kind of funny. So his plan now includes staying active and busy. Also, on another note, our patient mentioned it is very difficult to travel now because he always has to make sure he has to make arrangements to make sure there's a dialysis center near where he is going. He said this was hard for him to get used to, and it continues to be an obstacle in his life. So his physical exam, we obviously weren't able to do a whole physical exam, but we did take his blood pressure, and he said his blood pressure usually runs low because of his blood pressure meds and his dialysis now. So we took his blood pressure, and it was 101/52, and his pulse was 64 beats per minute. And his respiratory rate was within normal limits, which was 16 breaths per minute. Overall, his color looked very healthy, and he appeared his stated age. He also he was dressed appropriately and looked clean and put together. He was very personable, pleasant, talkative, and interactive, and he was very receptive to all of our questions and recommendations. We were not able to obtain his relevant lab data, but according to his last dialysis session, all his labs were within normal limits. Sometimes in the past, his phosphorus levels were increased, but recently this has not been an issue considering he is on the phosphate binders, and they have been very effective.
So the collaborative problem list that we both came up with involved 3 things: med adherence, diet adherence, and the fatigue that he experiences after his hemodialysis. And so I'm going to go through the SOAP note that we came up with. Subjective data that we subjective data that he told us is that he forgets to take his medication sometimes. He has trouble adhering to his diet regimen because he just enjoys eating all kinds of food, and he also feels tired after hemodialysis. The objective things that we noticed is that he does have a pill box at home that has 4 different times in the day and all the days of the week. He also has a list of foods that are good to eat and foods that are not good to eat that were given to us by him, given to him by us and by his dietitian, as she also gave him one. And he also goes to dialysis 3 times a week, hemodialysis, which is what he told us. Our assessment is that JS is a very friendly, interactive, talkative 76-year-old male that has end-stage renal disease and currently undergoes hemodialysis. His end-stage renal disease resulted from chronic glomerulonephritis that was a result of untreated hypertension. JS seems overall healthy and well aware of his disease state. He experiences fatigue after hemodialysis, and he sometimes has trouble adhering to his medication regimen. Oftentimes he does not follow his diet regimen, but he gets back on track. Overall, his labs were within normal limits according to the patient's last hemodialysis session. He gets hemodialysis 3 times a week and seems to be getting the appropriate effect from his medications. The plan that Courtney and I came up with were to advise him to follow his diet and medication regimen very closely and to make sure he gets appropriate rest after his hemodialysis sessions. I also advised him to take his medications as directed and utilize the pill box given to him by his pharmacist, as that is what would ensure his appropriate results for his disease state. I also advised him to watch out for adverse effects that may occur from the medications, and if they did occur, for him to report them to his doctor. And for some long-term goals for the patient that we came up with when we were interviewing him is that he wanted to make sure to relieve and control his glomerulonephritis and end-stage renal disease and make sure it doesn't progress any further. And and also to get a kidney transplant, which he recently got on the list for. So hopefully he'll be getting that soon. Some monitoring parameters include monitoring his creatinine clearance, which is done at his hemodialysis sessions, and also monitoring his INR, which is how he controls when he takes his warfarin. Also, we would like to see all his signs and symptoms remain steady as they are currently, with no increase or decrease in them. Well, decrease is always good, but no increase. And we also told him if he experiences any adverse effects, such as nausea, vomiting, dizziness, or any kinds of adverse effects that occur from his medications, to contact his doctor with any questions.
Also, we recommended him a strict renal diet, which includes staying away from protein, a lot of high protein foods, which will build up urea in the body, as urea is a byproduct of protein. Also, potassium is very important to keep a close eye on, and he needs to limit or eliminate leafy green vegetables, as that is an antidote for warfarin, which will make him clot. And phosphorus is really important as well, and he should really stay away from foods with phosphorus. And foods high in phosphorus include sardines, cola, nuts, cheese, liver, and peanut butter, and we conveyed this to him. And also sodium, we told him to limit his diet in sodium, as this can increase also the fluid volume in the body. So overall, we told him to drink a lot of water, maybe 6 to 8 glasses a day. Avoid salty foods and potassium, and foods high in phosphorus, and try to eat a good, healthy vegetable diet with fruits, whole grains, and beans. And we also gave him a paper pamphlet of a diet regimen so he can follow along with that at home. So this concludes our video presentation. It was really cool working with a pharmacy student. I learned a lot. It was cool that we got to work together, and I could see where she was coming from, and she could see how nursing can affect a patient care, and it was cool working together.
It will definitely help us. It will improve our collaboration with other professions in the future, and hopefully when practicing in real life, nursing and pharmacy can work together to provide the best patient-centered care that health professionals would want to give to patients. So thank you for watching and for giving us this opportunity.
Thank you.